Ballad Health. I want to thank you all for tuning in today. Thank you for those on Facebook Live, and I want to say thank you to the media for being with us as well. Also, just want to say a great thank you to our team members and all of the wonderful work that they're doing every single day to take care of all our patients. And with that, I'll go through the numbers in just a moment, but first I want to start with a couple of mission moments. We do this often at many of our meetings to really think about our focus on the patient, the things that are most important to us, which is to honor those who serve by delivering the best possible care. It's our mission, and it's the things that we really do focus on every single day. These moments are really gestures of kindness and opportunities for our team members to connect with our community and connect with our patients and their families. And oftentimes it goes beyond just the day-to-day caring, but it's also providing things for our patients that maybe they don't have. And many of our team members have been going through a lot this last 18 months, as many of us have. And so I'm always amazed at the great work that they do, and they go above and beyond to do certain things that really do show their care and compassion and love for our community. I'll start with one story that happened earlier this summer, and we, as you know, we have a centralized transfer center and communication center. And as part of that, we received a call from Deaton, Virginia, from the rescue the squad team up there out of Russell County. And it was from an expectant mother, and she was going into contractions, having contractions going into labor. It's a 40-minute ride from where she was to JMA, Johnson Memorial Hospital in Abingdon. And so, but the baby had decided that they were not going to wait for that trip. So the communications center and our EMS team there, the communication specialist was Jennifer Pearlhart, and she was talking with the EMS team. And unfortunately, what happened was the team saw, as the baby was being delivered, saw feet first, which is often a very kind of scary thing, especially if you're a EMT in the back of an ambulance helping deliver a patient. They realized that they were not going to make it to the hospital in time, and so Dr. Elena Magrins, which is one of our ER physicians in the area, got in touch with the EMS team and actually helped them walk through the delivery. And so they did a great job, and they actually lost cell service in that part as part of the trip down. And so they were able to reconnect, and our team through the communication center helped that happen. They continued through the rest of the delivery. When the baby was born, it was not moving, and so obviously a lot of concern there. But again, Dr. Magrins stepped in with some instruction to the EMS team and provided them actions that they could take, and it was very successful, and the baby did very, very well. And interestingly, the baby was born within 30 minutes of the call coming in to EMS. So happened very, very quickly. That's just a great example of the teamwork that our teams do, not only with internally, they do with external groups like our EMS teams across the region. And we also just say thank you to our EMS teams that we work with. They've done an amazing job in the last 2 years. We've always had a great relationship, and always admire the great work that they do. But they are under tremendous pressure today too, just like many of our other healthcare providers are. And we so much appreciate the hard work that they do every single day. Another example is in Kingsport. One of our case managers, Cassandra Hall, was working with a patient who was unable to get medications. And as you know, some patients are not able to afford medication or able to get their medication timely. Cassandra took it upon herself to go to a local drugstore and bought the medication out of her own pocket and provided that to the patient, and so the family could go home safely and securely. And then finally, in Kingsport also, at Wholesome Valley, Penny Van Huss and Amy Light responded to the call to care for 2 teenagers in the area who were homeless and really had nothing to show for it, no possessions at all. And so Amy and Penny bought a duffel bag full of clothes, hygiene supplies, and other types of things that the kids need, and provided that to them, obviously at their own expense. And so these are just a few examples of the things that our team members do to go above and beyond, on top of dealing with what they're all dealing with the pandemic across our region. So thank you to you all for your compassion and great work that you do. You make us so proud every single day. I want to go ahead and open up the scorecard and show you where we are today. We're at 39.7% fully vaccinated. We have had, our positivity rate has actually moved up to 20%. I'll share a little more detail on that in just a moment. Unfortunately, in the last 7 days, we've had 49 deaths across the region. We now have 331 patients in the hospital. We have 63 admissions yesterday, 9 PUIs. That's the patient center investigation. That has dropped a little bit, so our testing has caught up there. Today we have 77 patients in the ICU and 48 of those patients on ventilators. We'll share some more information with you, but many of these patients in ICU, and I think we only have one patient on the ventilator who's actually been vaccinated. So most of these are unvaccinated people. And then another, I think, disturbing number we're seeing today is that our pediatric patients have increased to 11 at Ansley Children's Hospital, and so we have 11 in the hospital today. So as I said, 331 patients in the hospital. A week ago, we had 281, so that's an increase of 50 patients in the hospital just over the past week. Some positive news is that we now have 280 patients in our Safer at Home program. And you remember that is a program where patients are taken care of in a home type model. They're provided some supplies to go home with, and then we utilize our virtual medicine program to help monitor those patients at home. So that really means that we're caring for over 620 patients across the region now, either through inpatient stay or through the Safer at Home program. So looks like that we're on track for exceeding 400 patients next week if the trajectory continues as it is. Again, the regional testing rate's at 20%. And as I said, we have 11 pediatric patients. Of those 11, 6 are in the pediatric intensive care unit. 28% of the patients that we're seeing, we're diagnosing most recently with COVID-19 are under the age of 18. So we're seeing a larger number of children and those under the age of 18 testing positive. So let me go ahead and share with you the information we have on the forecasting slides. I think we'll do that. So again, this past week we saw an increase from 5,063 to 5,661 is our new total number count. That's about a 12% increase week over week. So I think the good news is that we had about a 45% change here week to week, but this time we're seeing about 12%. So a little bit of slowing, but if you'll notice, this is the highest number of cases we've had in this year. If you look at it, we had some higher numbers in the previous year, but this year so far, it's the highest count we've had in 1 week. And then this shows the in-house patients that we have. 58% of the patients in-house are between the ages of 40 and 69, so over half are in the 40 to 69 age range. The overall age of our patients in-house has dropped again. Remember, I think a week or so ago it was around 60. It's now just right at 58.9, right at 59 years of age, so that continues to drop. Of those vaccinated in the hospital, the average age is 69 years of age. Unfortunately, those unvaccinated, we continue to see that age drop, and it's at 58 years of age now. So considerable drop in the age of those hospitalized that are not vaccinated. This is something we want to add because we are very appreciative, and we do think that this Safer at Home program is really helping decompress and create capacity within the healthcare system itself. The light blue shows you the total patients that are enrolled in the Safer at Home program, and then the darker purple color here really represents the new referrals we have on a daily basis. So every day we're seeing more and more patients coming in to this, and typically these patients stay somewhere between 10 to 14 days that are monitored, and they can take care at home on their own, or they're transferred to one of our other clinics for additional follow-up. And then you've heard a lot about monoclonal antibodies, and that therapy that's being used across the entire nation now, we've seen this being very effective in keeping a lot of people out of the hospital, especially if we're seeing people, we can catch this fairly early from a diagnosis standpoint. We can really keep people out of the hospital. This past week was the highest number of doses that we've administered at 204. And you can see back July 4th, that week we gave 8 doses or therapies at that time. And now we're up to 204. That continues to grow week over week. And again, it's a very effective therapy. Since we started this in December of 2020, we've given monoclonal antibodies to over 1,500 patients now. So it continues to be something we're really focused on. We look for different outlets to provide this, and actually been in discussions with a lot of different other providers to help provide this across the entire region as a therapy that we think is very effective. And then we look at the census numbers here. We continue to see a faster growth rate than we saw compared to the surge we had last year. Our current census is at 331. You can see the trajectory that we had compared to last year. I fully expect that we will exceed the 361 this next week because we're on a continued upward trajectory moving forward. So we were at 361 back in January the 5th of this year, and again, should be on a trajectory to exceed that. Although I do see it is starting to flatten a little bit, I think we will exceed our number that we had before. And then, as you said, our positivity rate, we saw a pretty big jump in positivity rate this past week. And just so you see, we are higher now than the average for Tennessee. We're at 20%. The average for Tennessee is 18.3. We're well below the average rate for Virginia, which is at 10%. So we're double the Commonwealth of Virginia now. We do have a few counties where we see some hotspots. Carter, Hancock, Washington, Sullivan, and Greene are over 20%. I would say if you look at Carter and Hancock especially, they have a lower vaccination rate in those two areas, which could obviously account for a higher positivity rate there. Then our vaccinations, partially vaccinated across our service area is at 45.6, fully vaccinated at 39.7. We are still below both the Tennessee average and the Virginia statewide average. Virginia's at 56, almost 57%, and Tennessee's at 41. We're still lagging at 39.7. We have seen an increase in the last few weeks now. In this past month, we actually went from 37.3 to 39.7. So we'll take the wins that we can get at this point. So 2.5% percentage point increase is obviously positive. We want to see that continue to grow in the next coming weeks and months. And then this is the forecasting slide that we do, and you can see 5661 translates. So this the kind of minimum impact to us, or the higher impact is starting to come together, but that gap is starting to close a little bit. So worst case scenario is around 450 patients next week, and I expect this to be again to exceed the 360. So between 375 and 450, if we continue on the same trajectory that we're seeing today, we could exceed be 392 to 470 the week after that if we stay on the same trajectory. Also, we are seeing an increase in deaths across the region. 74 is what we're projecting, and then 83 and 98. So we do expect, unfortunately, to see additional deaths happen. Right now, we're seeing that of the deaths that do occur across the system, 1 in 4 are people that have had COVID-19. So over 25% of the patients that are dying within in the healthcare system are as a result of COVID-19 complications. So our surge planning continues as we have done in the past. We continue to see the numbers rise. Last week, as you know, we did postpone elective procedures. We're very anxious to start those back, and even though we do have to put a hold on elective procedures in the hospital, we do work closely and are affiliated with a number of outpatient surgery centers across the region. And many of those surgery centers today that Ballad works with and others can accommodate many of the cases, or some of the cases that we're having to be postponed at this time. So we work with several healthcare providers, physicians, surgeons across the region, and we have surgery centers today that we operate and work in Abingdon, Bristol, Johnson City, and Kingsport that can provide oftentimes another location to have this surgery done outside the hospital. Again, we're planning for worst case scenario. We continue to look at our surge plans to exceed over 500 patients, and we'll continue to look for opportunities to expand that capacity as we move forward. I really want to say thank you to many of our team members for the work that they continue to do and helping us make these capacity opportunities. It's oftentimes a challenge for our team members to have to relocate from one area of the hospital to another to help do that, but oftentimes they do that. They're very supportive of the plans that we have made, and I just want to say thank you for them that do that. So we'll continue to look for resources to care for our patients. We mentioned scarce resources last week. We're not at that point where we would implement scarce resources, but we are continuing to plan for that. And these are very, very difficult decisions as we work through it. Most importantly, I think we really want to focus on the children of our region and make sure that we're doing all we can to protect our children. We still believe and support mask mandates and masking in our schools. We think that's important to keep children safe. And would also ask you to, when you're in an area where you cannot socially distance, that you wear masks, that you wash your hands, you're doing all the things that you can. Most importantly, would ask that you get vaccinated. We have a fairly large number of children in the age of 12 and under who cannot be vaccinated, and so we have to protect them. And oftentimes we have to take precautions to do that. Today, I'm really honored. We are really honored to have Dr. Myesa Emberesh with us today. Dr. Emberesh is a pediatric hematologist and oncologist with St. Jude, and we're so thankful for her to be here. We're thankful for the great work she does in our region. We'll ask her to come forward at this time and share some remarks with us. Dr. Emberesh, thank you.
Good afternoon, everyone. My name is Myesa Emberesh. I'm a pediatric hematologist oncologist. I have been with St. Jude Tri-City affiliate for over a year now. I would like to start by thanking the media and the viewers tuning in. Every day I take care of children with cancer and blood disorder. I'm just one scared physician speaking out on behalf of the children of our region. We are terrified. The past few weeks have brought tragedy we hope we would never have to see. And the fear is only the beginning. Last weekend, my own child was sick. One of my first thoughts was, will the hospital have room for us if we need it? The numbers we are seeing in the Appalachian Highlands are terrifying, and the potential to affect every child in our region. If our children's hospital is full with COVID-19 patients, what does that mean for other children who need emergency care? Last year, kids who contracted COVID-19 were mostly asymptomatic, but now more children are getting sick because we are allowing this virus to spread. And more it spreads, the more it mutates. Unfortunately, we had the first immunocompromised child with COVID-19 in my clinic last week, and we fear more will come. Many of these children are younger than 12 and do not qualify for COVID-19 vaccine. They are the most vulnerable people in our region. I do not want to see COVID-19 rip through the bodies of these children with cancer. I do not want to see them gasping for breath or managing long, hollow symptoms on top of their adverse effect from chemotherapy. But every day we see ourselves inch closer to that reality. I understand that no children wants to wear a mask, no adults either. But the Delta variant is hitting kids more, and it's hitting them harder. And this virus has the potential to be devastating for these children who I work with every day. It has the potential to be devastating for any children who needs emergency care and is met with an overburdened emergency room. That thought is terrifying to me and to all of my colleagues who work with the vulnerable children every day. When the COVID-19 pandemic began locally 18 months ago, we knew we were gearing up to fight a war against the virus. Now we are enduring a battle against misinformation. The science is clear and undeniable. Masks work, vaccine works, vaccine works. And the more we allow this virus to spread, the smarter it will get. The more the virus mutates, the longer it will be in a war with it. The longer we are in the fight, the more lives we will put at risk, and that concludes children. The best thing we can do to protect them is to get vaccinated and wear masks. So let us all work together, protect our children, and surround them with a vaccinated community. Now I would like to introduce Kate Strickland, our clinical manager at the St. Jude affiliate at Miss Winger Children's Hospital, who will be reading a letter from one of our many scared parents. Thank you.
Hello, I'm Kate Strickland. I am the Clinical Research Associate and Manager of the St. Jude Clinic here in Myesa Children's Hospital. I have been with St. Jude in the Appalachian Highlands for 17 years now. So first I want to start off by saying it's September 1st, which September is National Childhood Cancer Day month. So please wear gold and support that in the research. So my job, other than manager, is to work alongside St. Jude Memphis to provide the world-class care for our local families through research and through the care that we're able to provide them. So in my work, I am an advocate for our patients and our families. And today I'm here as a voice for them as well. So our St. Jude families, they are fighters. They face the situation that no parent ever wants to have to face. And for them, as long as this treatment takes, the families, they are in this battle right alongside their children. And now, unfortunately, they're fighting against COVID-19. The children in our clinic are very young. We have all ages. Very often, they're immunocompromised, and they're at incredible risk of COVID-19 pandemic surge. They have something to say. So I'm going to share a letter with you. This is from one of our local families, the McClellan family. This is their son, Gus, who was with us for 3 years fighting leukemia. Hello there. We are the McClellan family. We are a St. Jude family. Our son, Gus, was diagnosed with leukemia in December of 2016. We sat in a room and we listened as our world began to fall apart, learning all the things we would have to do to keep him safe. We grieved, and then we began our fight. This is what a cancer family does. We go to work to keep our children. Our Gus is now 2 years post-treatment, all thanks to his wonderful St. Jude team and science. The world of COVID-19 has been and is scary for a family like ours. We know from experience how fragile and precious life is. We know what it feels like to almost lose a child. We know that immune-compromised children and adults count on us to keep them healthy. We know that vaccines are not available to everyone. So those of us who can be are vaccinated in our home. We know the importance of wearing a mask. When Gus was in treatment, we often masked, and in doing so, we all kept him from catching lots of crud, so we masked. You do these things without question when a life depends on it. Our children were remote last year, and they ached to be back in school. We felt after last year's numbers, this year would be handled much the same. So therefore, we had the confidence and the ability for our children to safely be there. This new school year has been exceptionally hard to see unfold. We saw cases rising again. We were hopeful for a mask mandate, and then we felt defeated to see loopholes created to appease people who are choosing to ignore the truth. The facts are presenting themselves, and some are simply pushing them all aside out of their own selfishness. We know it is hard to change your normal routine. We had to in big, big ways years ago. But we also know it is effective in protecting what you love and those around you. Our region's children are getting sick. Our middle child caught COVID-19 his first week of school. He was the one of two masking in a class of 21 in a school of thousands that is now shutting down halls left and right. Masking is a two-way street. It is most effective when everyone is on board. We entered panic mode in our house when COVID-19 arrived. We ran strict protocols and kept it from spreading. Our unfortunately learned skill set from being a cancer family proved helpful, but there was still frustration and anger. It's been really hard to see mask wearing become such a point of contention. If you walked in the halls of St. Jude, you would quickly see that masks are a lifeline. They allow children to thrive and be engaged. They allow you to feel connected to the outside world when things just don't feel safe. Our children should be masking in schools, and those who can should be vaccinated. There are no quick fixes. Ignoring what is happening will only cause more devastation. We simply need everyone to collectively do what they can to keep everyone safe. We need everyone to care. Signed, Logan, McClellan, and family. The McClellans, like all of our St. Jude families, and now all of the families fighting COVID-19 with their children at My Stronger Children's Hospital, know how fragile and precious these young lives are. These children did not ask to be sick. The children whose lives are being threatened with COVID often don't have a choice to be vaccinated. That's why they need us. In our hospitals, we do all we can to care for them. And in our communities, we are asking that you do all you can to protect them. That means masking. That means advocating for safe practices in our schools. And that means vaccines. Thank you very much for listening. And so now I would like to introduce Jamie Swift, our Chief Infection Prevention Officer.
Thanks, Kate. I hope that her words will help people that maybe haven't been vaccinated now use Childhood Cancer Awareness Month as a reason that we can all join together to keep our community safe. As always, I want to thank our team members for the work that you all are doing on the front lines as this burden continues to get heavier and heavier to bear. As you've heard today, our numbers are quite grim. Just this morning, the Tennessee Department of Health shared that Tennessee now has the highest rate of cases in children based on cumulative cases for 100,000 among the 48 states and 2 territories reporting data. We are doing all that we can to prepare for the worst, but our healthcare workers are tired. And I'll be honest, even I did not think we would end up to the point that we are with our cases and our hospitalizations. I did not think we would get back to the level that we're seeing in our community. Ultimately, there's not a lot I can stand up here and say anymore, other than vaccines and masking are our way out of this. Vaccines work, they keep you out of the hospital, and they are safe. And we are happy about any improvement in our vaccine rates, as Eric has shared, but we are nowhere near the level that we need to be. As with nearly every aspect of this pandemic so far, there continues to be a lot of misinformation and distrust about the vaccines. But let me show you the reality of the vaccines for you. Slide. Of the 331 patients that we were treating for COVID-19, 21 are in cases of vaccinated people. 310 are unvaccinated. That means that 93.6% of our hospitalized patients are unvaccinated. Of the 77 in intensive care, 74 or 96% are unvaccinated. And 98% of the 48 patients on ventilators are unvaccinated. The average age of the unvaccinated hospitalized COVID-19 patient is 58.1. As Eric shared, for vaccinated patients that goes up to 64. We do have the one FDA-approved vaccine on the market, but we know that all continue to be safe and very effective. As we've shared, I think we can all agree that we want this to end. The only way to get this to end is to get as many people vaccinated as possible. As a reminder, our vaccine centers is open at the mall Monday, Wednesday, and Friday from 2 to 7. We are offering first dose, second dose, as well as that third dose for the immunocompromised patient. And if you're not sure if you meet that immunocompromised definition for that third dose, just reach out to your healthcare provider and have that conversation. We still have not received authorization from the ACIP to offer that booster for the general public. We're watching that closely. If and when that becomes available, certainly we'll be able to offer that at our vaccine center. As I said last week, I truly want to thank everyone who's gotten their vaccine so far. You're protecting yourself, you're protecting those around you, and ultimately you're protecting our team members who continue this fight. As we continue to treat more patients with COVID-19, we do want to review some of the treatment options that are available. We've talked a little bit about monoclonal antibodies this morning. And while the treatment has been in the news and not a lot lately, it's not new. We've been giving monoclonal antibodies since they became available in December of 2020 under an FDA emergency use authorization, or that EUA. It's the same authorization that the vaccines rolled out under, and that's currently in place for the Moderna and Johnson & Johnson vaccines. Right now, outpatient monoclonal antibody treatments can be ordered by all primary care physicians in the Appalachian Highlands. You do not have to be a specific valid provider. This is available for any physician to order. It's available for COVID positive patients who are older than 12 who meet the criteria to receive the drug. At this time, we do not offer monoclonal antibodies for preventive care. As we talked about with this current COVID-19 surge, demand for the antibodies is also increasing. We've had a 78% increase in cases week over week, and we expect that number to grow. Monoclonal antibodies are an increasingly promising treatment for COVID-19, especially if you get them early in your illness. So within that first 10 days of infection is when it's recommended. Beyond monoclonal antibodies, we encourage anyone with COVID-19 to seek early treatment should you need care. It often can prevent hospitalization. But while we're on the treatment options, we also have to talk about the ones that don't work. Like I mentioned in regards to vaccines, there's a lot of misinformation out there, especially online and on social media. I beg you to please listen to the medical experts when trying to determine treatment options for COVID-19. There's been a lot of conversation about ivermectin, as we've talked about. It's an antiparasitic, most typically used in veterinary settings. There is no current legitimate evidence or research that supports it as a COVID-19 treatment. Similarly, hydroxychloroquine was once hyped as a potential COVID-19 cure, but there's also no supporting evidence that that works either. Certainly, we completely encourage healthy eating, vitamins, exercise, staying well, but that also is not a replacement for the prevention measures such as the vaccine. We recognize the interest in providing a variety of medical care and interventions when it comes to caring for patients, but right now, the literature, the science, and the medical community believe that monoclonal antibodies is one of the most promising courses of treatment. We're going to continue to follow the science, continue to follow the FDA, the CDC, the medical research, and offer the cutting-edge treatments that are available for COVID-19. Before we wrap up our comments, I do want to remind y'all about COVID-19 testing. As the Delta variant increases, that means we have seen a significant increase in demand for testing. With so much community spread, we all need to have a very low threshold for testing. So I can't encourage you enough. If you have any symptoms, even if you think it's allergies or just a cold, it is really important that you go get tested. And while you are being tested, you do need to quarantine at home and wait on those test results. If you need a COVID-19 test, please schedule an appointment online, or you can call Nurse Connect. You can get your test performed at one of our drive-through locations. We do not recommend that patients come to the emergency room strictly for COVID-19 testing. Please schedule through testing through Ballad Health Nurse Connect. That number is 833-822-5523. As we've shared, our staff are stretched extremely thin throughout the system, but especially in our emergency departments. If you come in for only a test, your wait time will be extremely long. High demand for testing also means that it's going to take longer to get your results. That's not just within our system, that's across the nation, across the state, and right here in our region at our other testing sites. As I said, it's really important, even though that may take a little longer, that you stay home while your test results are pending. You can't really get tested and then be out and about waiting on that test result. Our staff can only run so many lab tests per day. I promise you they were working extremely long hours. They're coming in early. They're going home late, trying absolutely to run every sample through the lab that they possibly can to get you timely results. It's a really hard time, and I think we can often forget that it's a hard time for everybody. So please remember to just treat everyone around you, and not just our healthcare providers, but everyone with a little extra grace and patience. I want to thank you to everyone who's been supporting our teams and our communities through the pandemic. And again, I want to thank everyone who's gotten a vaccine and taken that step to protect yourself, your community, and our health community. That's all of our prepared remarks. I will turn it to Eric to open up questions.
All right, let's keep it to 2 today. Ansley, do you want to start us off?
Hello.
Yes. Let me set up. So I know that you just mentioned how important the monoclonal antibodies are. Do you have any plans to set up clinics, and also are you guys still seeking donations for antibodies as well through the blood centers?
I'll let Jimmy talk about the clinics that we are in the process of setting up.
Yeah, so we are, currently we have various sites. A lot of the monoclonal antibodies have been delivered through appointments in the emergency room. So as those orders have come in, those patients get scheduled at various sites. We actually are in the process recognizing the need of setting up a separate infusion center where we have multiple infusion bays where we can run several patients at a time. Our goal, if we stay on track, is to have that open by Monday. Certainly we will share that information as it becomes final, but we are actively working just as quickly as we can to get that stood up.
And I know that, this might also be for you as well. I know that you just mentioned ivermectin and the misinformation about it. Have you had any issues locally? Has anyone come in maybe with issues from taking it, or what exactly did that do if someone decides to take it?
I personally am not sure of ER visits. I think we could probably get that information if it's needed. Yeah, I think there's always people that have questions about should they take it. And honestly, our physicians try to have those one-on-one conversations and educate the patient or the family members of really what the studies show, which studies were redacted, which studies really are based on science, and why that's not a treatment option at this time.
Okay, Caleb?
Yeah, I wanted to ask more about the scarce resources plan. We haven't seen the detailed document, if there is one, but the letter that has been spread widely says that there are detailed criteria for what ranking folks go in and that. What are some of those criteria, and is vaccination status one of them? A lot of folks have access to that.
Yeah, we don't determine care on vaccination status. We take care of people based on their acuity of their illness. And so actually, I'm not prepared to be the one to discuss that today. The exact criteria, I think really that it's best that one of our physicians do that in the future. So we could provide that information to you. But we do not reject care to anyone based on their ability to, or if they have the vaccine or not. So again, it's based on the acuity of their illness when they enter the ER, their triage. We care for people that way. So, but the criteria is pretty detailed. There's a lot of information around that. Caleb and I prefer that one of our physicians address that in the future if we could.
Well, I don't see the St. Jude folks anymore. I was going to ask about the immunocompromised kids at the
Yeah, Lisa Carter may be able to. And once you ask your question, we'll see if we can answer it for you.
Yeah, she had mentioned about a first immunocompromised child patient. I was wondering how COVID-19 is different for those kids than for someone who's not.
Okay.
Sure. Oh,
Okay.
yeah. I mean, it's really similar in children who are immunocompromised as it is with adults. Obviously, having the ability to fight off infection is really, really important. And Jamie mentioned the vaccine currently available, the booster for those who are immunocompromised. And so we know how difficult that is to keep those kids from catching even a common cold. And also we know any of those illnesses are just amplified when your natural immune system is weakened and not able to fight it. And so we take very seriously those patients within our building. And as Kate said, obviously if you walk in the St. Jude Clinic, seeing people masked has always been a standard. And so being able to keep them safe is really, really important, and being even more diligent in those aseptic techniques that we do in the hospital, infection prevention efforts, they're all very important for those kids. And so we have just amplified a lot of those efforts.
So do those kids end up sicker if they get COVID?
They could potentially, yes, end up sicker just because of the body's weakened immune system and the natural ability to fight off the infection.
Okay, David?
I want to follow up on the antibody treatment. Do you all have the capacity? Is there a supply, an ample supply out there that you all can greatly expand that ability? It sounds like it's a very positive response. So
Yeah, we really focus on that. Actually, our emergency operations team today discussed making sure that we're acquiring additional supply of that. The supply today is pretty good from what we understand. I think there is a little bit of timing on once we order getting it in timely. So, but we are trying to be really proactive and order more. So we do have have that available to our patients. So as of today, there's not a scarcity of it, but we are trying to be proactive to make sure we have additional supply on hand.
okay. My other question is kind of a numbers question. You all have talked a lot about a nursing shortage and being shorthanded. Can you quantify that a little bit, and how complicated is that being if you've got a lot of folks out who are sick with COVID?
Yeah, so today we have probably over 300 contract labor nurses across the system. So that's a very large number of people from outside the area coming in here to work. But that's because of our census is as high as it's ever been. We have over 1,200 patients across the entire system today, not just COVID patients, but obviously other needs. So yeah, we continue to recruit, to look for more and more staff. As we said before, we have reached out to retired professionals to help us with that. We have to actually have people that are helping us with that. But we continue to have a great need. As we see sicker patients, then we have to evaluate how we go about the nursing teams. And we have to support our frontline nurses, not only with like CNAs, with nursing assistants, but with other personnel that can help support them so they can take care of more patients. And so it's we're looking at every different scenario today to help support our frontline team members to care for patients.
David?
Yeah, I was kind of piggybacking on that question. I was wondering if you knew what the current patient to nurse ratio is.
It really varies, and it's hard to say because in ICU typically we have a 1-to-1, sometimes 1-to-2. It really depends on the acuity of the patient, and we do that by shift. And so that's why if we have to push the acuity or have to push the ratio higher or lower, especially higher, then that's why we kind of have additional support staff around those nurses who are taking care of those patients. But it really does vary by hospital, by shift, by patient, really. You can.
And so one of the concepts that we're introducing, and that really is a standard practice, is team nursing, to where you can expand ratios but expand them safely. And so you have one critical care nurse, a progressive care nurse, and a med-surg nurse. So the med-surg may not feel comfortable taking care of an ICU patient directly, but you pair those three nurses together and they take care of a larger number of patients very safely, and they work together as a team. Team nursing is extremely popular, and it's a model that works well.
But I guess fundamentally, you still feel like you're at a point where there's enough staff to meet the demand for patients.
Well, that's part of the reason for really, again, stopping the elective surgical cases so we could utilize staff in different ways. So we continue looking for that. So after elective cases, work with our surgical teams, and there's other types of things like therapy and people like that, we would have to pull in. We've even talked about pulling in people from our corporate area to help in a support role. So Today, yeah, I think we're okay today. Our team is very stressed. They're overworked. They're getting burned out. So we really need mitigation from our community. And as we said earlier, we are really begging our community to get the vaccine. We know it works. It protects people like the McClellan family that we heard about earlier today. Our partnership with St. Jude is very precious to us, and those patients are very vulnerable. So if you're going to get a vaccine, not only do it for your community, but do it for children like we see here every day. They really need that protection. So, but we've been doing this for 18 months now. Our team is extremely burned out, and we want to give them the relief of having fewer patients in the hospital that they're caring for today.
Is it one more? Has there been any recent talk about a vaccine requirement for staff at all? And is that also a function of staffing?
We talked about that as an emergency operations team. We have not had a mandate or a requirement yet. We are looking at what other healthcare systems are doing and the application of that, how that would work if we did roll that out. But there's been no decision on that at this time.
Okay, we're gonna open up the line. All right, Spencer, do you have any questions?
Yeah, you mentioned that your total patient census is still hovering around 1,200. As more COVID patients spill into the hospital, how far can you push that top 1,200 number? I know that you have surge planning to handle more COVID patients, but as the total number of patients grows, how high do you think you can take that number before things get really uncomfortable? I know they're already uncomfortable, but how far can that 1,200 number be pushed?
If you look at the number of maybe additional beds that are unstaffed today, probably around 300. So we would continue to look at additional, 300. We can also get to a point where if we have to create ward type nursing, similar to the team nursing that Jamie was talking about, we could set up areas where it's more like a ward situation versus individual rooms where you have a number of patients in one large area, and then that really does expand your ability to see and care for more patients. It's not ideal, obviously, because you lose privacy. Just that that's gives you a whole new degree of difficulty in caring for patients at that point. But we can continue to expand that, and we will. I mean, we're the healthcare provider for our region. We're not sending patients out of the area. We're trying to care for everyone that we can here. We'll continue to push the ability to take care of everyone that walks through our doors. But there's limits to everything. And so that's what we're really hoping people will get the vaccine and start to turn this around. We're also, I think we're seeing more mask requirements happening across the region and school systems. We'd ask people to participate in that and be a part of it and be part of the solution.
Do you have any other questions, Spencer? Okay. All right, Richard, do you have any questions?
Yes, I know there were, in the first wave, about 20 National Guard members that were on hand to help the Johnson City Med Center. How's that going, and have you all applied for that second round of help yet?
It's going great. We greatly appreciate our National Guard members and the work that they do for us. They're really invaluable to us today. They provide great support and great care to our patients. We have applied for additional units to be stationed here, and we're waiting for that response at this time.
Do you have any other questions, Richard?
Yeah, I guess just to follow up on that, will you be deploying them to, say, Holston Valley and Bristol if you get them, I guess, wherever needed?
Yeah, Richard, our highest concentration of COVID patients today is at Johnson City Medical Center in our southern market. But the request that we have made is to look at placing them also at our other two tertiary hospitals at Holston Valley and Bristol Regional. So that's typically what we would do in that case.
Okay, do we have anyone else on the line? All right, I guess that concludes today's press conference. Thank you all.
Thanks very much. Thank you all.